One of the reasons I came back to this area was that my husband was farming. He had been doing construction when I was in medical school, and then he decided he wanted to move back to farming, which is his first love.
Dr. Danette McAlhaney has been practicing in Bamberg County for over 20 years. This rural county has about 15,000 residents. Access to health care is one of the biggest problems its current residents face.
When I first came here, Bamberg County Hospital was very viable. In fact, it was a bustling hospital. And over the years, the number of inpatients sort of declined. What we found was the technology in medicine had expanded so much that it was difficult for small hospitals to keep up.
Bamberg County Hospital closed in 2012, and when the hospital shut its doors, it left a void in specialized care.
We're 85 miles from Charleston, 60 miles from Columbia. Most parents have no transportation, so they don't have that luxury of being able to take their child, even if they want to badly. I mean, I'm not saying that the parents don't want to do for their children what they can, but sometimes their hands are tied. They have no insurance, they have no transportation, they have no money for lunch when they go up there. It's just a vicious cycle.
Bamberg County's poverty rate is one of the highest in the state, with about 75% of the children in the schools on free and reduced lunch.
The school is one of the few remaining positives that we have. We no longer have a hospital. We don't have a grocery store. So we've lost a lot of things that are appealing to people who need to move to a community. We are very depressed economically here.
Seeing the needs of her patients, Dr. McAlhaney decided to try out a new platform of healthcare that would keep quality care local and more affordable. It was telehealth.
It virtually transports the doctor to the local community where the patients live. So in our model of telehealth using psychiatry, the patient goes to their primary care doctor's office, and then they start a secure video connection with our site here in Charleston, South Carolina, and we are able to maintain a live video connection so that we can conduct our appointment completely securely, but also, where I don't have to leave my office and they don't have to leave their hometown. And you're not missing out on what we call specialty care. You can have the same benefit as somebody who lives right here in downtown Charleston and be 3 hours away.
We were the first ones to do a telemedicine visit with telepsych with Medical University. It's hard to find psychiatrists in the area to refer patients to. So by having the ability to use Medical University and the telepsych program, we've been able to provide that service to our patients.
The telepsych program proved to be a success with Dr. McAlhaney's patients, so she decided to try telemedicine in the local school systems as well.
The telehealth program has allowed students to be able to be seen by a doctor. That doctor is Dr. Danette McAlhaney, and it's amazing to me. They have equipment. You can hear the heartbeat, you can look in the ears, all of this on a computer screen. You can look down the throat. It's a visit to the doctor, and you have everything except the doctor being able to touch you.
Now parents won't have to leave work to take their children to the doctor. Students now have access to quality care, and it saves families time, money, and resources.
Our parents have been very receptive of this. Dr. McAlhaney is probably the family doctor for many of our students, not all, but many of them.
We are familiar with the kids. We see a lot of them, so we know which ones struggle with asthma, or he's there at the nurse's station saying he has a sinus. We'll know it's probably his allergies. So we know them more personally. We know their history. We know what meds they're on.
And keeping things in the town, especially small towns where people in small towns know each other. We know each other through church. We know each other through civic organizations and seeing one another in the local Hardee's.
The technology alone won't get you there. So what you're doing is you're taking advantage of that relationship with a trusted physician in your community, someone that people know and know that will take good care of them, and then using the technology to get them in settings where they would not have been able to provide care before.
Obviously, in a practice like mine where we're growing, and right now we've outgrown this facility, so that's why we're building the new facility. It's sort of tough because if I can see a patient in this room, I'm already squeezed with the number of rooms we have. I'm excited about getting into the new building because we will have extra rooms, so we'll have extra space and we'll be able to do more of the telemedicine visits in general, but I think we'll have plenty of room there to expand the program.
I love my small town. I love being here. I've never had a desire to go to a city. I love working and knowing that, I guess when they're my patients, they become my babies. And so when I see them out in the community, you know, my husband's used to it. We go in the store, we go to a restaurant, we go to church, and everybody's coming up to me, and I don't mind it because I love them, and you know, I want the best for them. And so if there's anything I can do as a provider to make things better for them, you know, I'm gonna do it. And I think this telemedicine is one of those answers.
Dr. McAlhaney is a wonderful example of a family physician who has made the commitment to be in a rural community. I consider those to be real heroes. The key is making sure that she can do everything that she needs to do for her patients locally if possible. And that's why the beauty of having a practitioner like Dr. McAlhaney being connected to a range of telemedicine and telehealth resources.
This is home. Could we have gone anywhere else, all of us? Absolutely. We just didn't choose to. And when you make that choice, you need to make the best of it. And the best of it is doing everything you can to make the place where you live as good as it can be.